Hi, everyone. Welcome to our Ask an Expert series that's being put on by the Chicago Asthma Consortium. My name is Matt Seymour. I'm the Executive Director at Mobile Care Chicago, which has two asthma vans that travel around the city and provide specialty care for kids who have asthma and allergies. And I'm joined by Dr. Molly Martin and Dr. George Paul um, to talk today about COVID-19, emergency departments, and children with asthma and potentially COVID-19 in particular. So I'll turn it over to Dr. Martin if you want to introduce yourself.
Thank you. My name is Molly Martin. I'm a pediatrician at the University of Illinois at Chicago, and I'm also a pediatrician at Miles Square Health Centers where I practice.
Excellent. And Dr. Paul?
Yes, I am a pediatric emergency physician at Stroger Hospital in Cook County, and my practice is primarily pediatric patients, though I do have an adult population that I work with as well.
Excellent. Okay, thank you both for being here. And as you can imagine, the board of the Chicago Asthma Consortium and the providers in our various clinics have been getting a lot of questions from people who have asthma about COVID-19 and specifically about how they should be either treating their asthma or thinking about their options for treatment of COVID-19 if they're exposed. So I'll get right to it. The first question that we have, and Dr. Paul, I'll address this to you, is that currently we're hearing a lot in the media about adults who have potential exposure to COVID-19. We're not really hearing a ton about children and their risk level and potentially what you guys in the ER are seeing regarding children and what symptoms they might be presenting. So could you speak to that a little bit?
So it appears almost as if there are two disease processes. So in adult patients, and in this particular case, I'm going to be a little liberal about how I use adults. Patients 18 and older often seem to have symptoms with it. And those symptoms can be headache, fever, sore throat, dry cough. However, younger children often don't have any symptoms at all, or if they do, they're mild symptoms, symptoms that would resemble a cold. And so in the news, we don't hear much about children because the predominance of patients who have more severe disease tend to be adult patients. It's not that children don't get the disease. They can have the virus, carry it, and even spread the virus. However, their symptoms may be very mild or no symptoms at all.
Mm-hmm. And if you could describe for us, in an ER setting now, what's different from what people would see maybe 2 or 3 weeks ago or before the current pandemic changed a lot of protocols or guidelines, within the ER setting?
Well, initially we were thinking that the spread of the virus primarily was in groups who were at high risk. So those who had traveled to countries that had a large predominance of the disease. However, very quickly, the disease has spread into the community. And so most of our transmissions now are from persons to persons. And this is why the whole concept of staying at home and self-quarantining has become so important. So even as we talk with my coworkers, we would think that our greatest risk of getting sick or getting infected with COVID-19 would be from the hospital. Our greatest risk probably is being out in the community and intermingling with other people that may have the virus and not know it. So that's been a significant factor in terms of how we've changed our protocols and how we're looking at the disease. We are now just assuming that everybody has it and then acting on treating the symptoms that they present with.
Uh-huh. And if somebody had symptoms that were bad enough or different enough from asthma attacks that they went to an emergency room, would they be treated or tested for COVID-19 as well? Or what would be the deductive process that you guys would go through to figure out if someone should be tested?
So in part, each hospital has variations of their protocol. But basically, the common trend is really the severity of the symptoms. So as we get a large number of people coming to the hospital asking for testing, if they have more mild symptoms, what we're likely to say is, yeah, good possibility that you actually do have COVID-19, but we're not going to be testing you for it. We're going to want you to go home. We're going to want you to drink fluids, get plenty of rest, distance yourself from others that you might affect, not only in the general public, but in your household. For those patients that have more significant symptoms, then we are more likely to test those patients. And if the symptoms are significant enough, meaning shortness of breath primarily, those patients will be admitted to the hospital for further evaluation.
Okay. And so this next one is a question that we got pretty frequently, and I've tried to distill it as best I could from like the many branches that this question could take. But so how does COVID-19 feel different from asthma? And do you think that people would be able to tell one from the other? And then sort of a section of that question, since we are talking about kids here, is how are parents describing symptoms, and what are you guys kind of on the lookout for? The sort of watchwords that, you know, if parents bring it up, it makes you think, okay, this is something that we should probably look into a little bit further.
So typically with your asthma, you're going to have shortness of breath. You might have wheezing and chest tightness. We typically don't see wheezing with COVID-19 infections, so that may be a distinguishing factor. Fever is probably the most common symptom that patients have when they have this virus, so that may be a indication that you might be infected with COVID-19. However, we also know that, especially with kids, colds can be a trigger, and that can also present with fever. I think the thing that we need to understand, we don't really have any treatments for the virus itself. What we do is we support our patients. Virus runs its course, and I don't think COVID-19 is unique or different than any other virus in that way. However, for certain groups of the population that get infected, and it's about 20%, they may need hospital support for their disease. So I wouldn't be overwhelmed with the concept, do I have COVID-19 or not? I'd really focus on how severe are my symptoms? How bad am I feeling? And if the symptoms are not severe, whether it's from asthma or some other viral infection, I would address the symptoms rather than focusing on whether these symptoms are caused by COVID-19 or not.
Yeah, that's helpful. That's a very helpful distinction. And Molly, I'll kick it over to you as well. You know, in your sort of clinic setting, like how are you talking to people about it, and you know, what sort of, how are people describing potential symptoms and its relationship to asthma?
I think the most important thing to remember is you can definitely have both. You can have asthma and you can have COVID-19, and you can have an exacerbation or an attack of your asthma that's brought on by the COVID-19, or that's just happening at the same time. So I think the first question is always the question with anyone with asthma: how is your child doing? Are they breathing okay? Are they coughing a lot? If so, have you given them their reliever medicine? Has it helped? Is it helping some but not enough? So the standard questions of how children are doing with their asthma management first have to be addressed. And we need to make sure that families have the right medicines to manage the child's asthma in whatever setting they are. The reason for going to the emergency room would be the same as whenever someone is having an asthma exacerbation or an asthma attack. Are they able to manage it sufficiently at home? And if not, then they need to bring in the professionals. If the parent is concerned that the child's not breathing well enough, if they're using a large amount of reliever medicine, if the child can't do any activities, can't speak well, can't sleep at all due to the coughing, those are reasons that the child needs to be examined by a medical professional. So one thing that we're doing in the clinical setting is we are still seeing children that are sick but don't necessarily feel that they need to be seen in the emergency room. They can be seen in clinics. People should just call their clinics, and there are processes where we can see them physically, or we can do telemedicine where we look at them the same way on this webinar. We can look at the child at home. Now, we can't listen to their wheezing over the telephone or over a WebEx or a Zoom call, but we can do other things, parts of the assessment, and we can talk about the symptoms and make sure that families understand how to look for things and are using their medicines properly. And we can also make sure that people have all the right resources so that they can be managing the asthma at home.
Yeah, and okay, so that brings up, Molly, your question is actually a good tie to the next question that we also got a lot in varying forms. But you know, the question basically is it safe for people to continue to use their nebulizers at home? And are you recommending alternatives to people to neb machines? And I'll throw that to Dr. Paul first.
Well, you know, there's been varying discussion about that in terms of the concern of the nebulizer spreading the virus. Again, what I have to recommend is that it's important to continue to use the same treatments that you normally use at home. And that if you are concerned about the potential spread of the virus through the nebulizer, then certainly you could wear a surgical mask. But the reality is that our meter dose inhalers, the little puffers, they work quite well. And my recommendation during this, since the jury is still out in terms of the amount of viral spread through the nebulizers, is to use an inhaler, and an inhaler with a spacer so we can get the medicine down in the lungs where it needs to be. And then we don't have to really worry about the concern about using the nebulizer machine as a vehicle of getting the medicine into the lungs.
Mm-hmm. And Molly, I imagine you're saying the same thing to people, but anything you would add to that?
Even before any of this happened, if you use your spacer and mask, if you need a mask for a younger child, if you use the spacer and mask and inhaler correctly, you'll actually get the medicine better than you do in a nebulizer. So a lot of people really feel comfort with the nebulizer machine, but the puffer with the spacer and mask works very well if you understand the technique. Now, for young children, for children who just aren't comfortable with the spacer or the spacer and mask, if they need the medicine, they need the medicine. You have to give it to them. I mean, that's just how it is. So then in those instances, you would need to go ahead and try and give them the nebulizer machine. But if you have the inhaler pump with the spacer and a mask, then definitely try to use that instead. And if you have the pump but you don't have a spacer and mask for some reason, call your doctor, call your clinic, and we'll authorize it. And you can run over to Walgreens and get them. You can even buy them online, although Amazon's a little slow these days. But you don't need a prescription to buy a spacer or a mask. Those are items that can just be purchased.
Wonderful. So, Dr. Paul, this is a question I think that we get from a lot of people who hear about COVID testing and are wondering like what a test actually is. And so, yeah, our next question was, you know, after what threshold would you recommend that someone seek out testing? And then what is a COVID test like?
Okay, so the COVID test is a swab test. And there are a couple, depending on the system that they're using, they can swab the inside of the mouth or they can swab the inside of the nose. And what we're trying to do is get some of the protein from the virus, and they do a test that looks at the RNA, which is kind of like the DNA signature of that virus. and see if it compares to the model that they have. So that's the test. The test is a good test. It's not the greatest test we have, it's a good test. So if you're familiar with the strep throat test, you'll know that a rapid strep throat test, if we swab someone's throat, if it's positive, we can pretty much believe it. But there's still a small percentage of people that test negative that still may have the virus. And that's still the case with the COVID-19 virus. And so that's why we're trying to limit the testing to those people we think have the highest probability of having the disease, because that makes the test more, the strength of the test more valuable. Who should get tested? Really, those patients who are going to be coming into the hospital, that's a group to be tested, because we want to separate those that we know have the virus from those who don't have the virus. But in terms of the general public just getting tested for self-assurance, one of the things I want to caution against that, so let's say you go into your local healthcare facility and get tested and you test negative. Boy, that gives you a sense of relief. I don't have the virus, but it really only speaks to that second in time that you got tested, because you can walk out the door and come in contact with someone that you didn't know had the virus and then pick up the virus and be positive for it and not know it. So I'm really not recommending that we generally test people unless there's a strong indication for it.
Okay, and then this one, Molly, you had sort of started talking about this, but it is a common question, like, how should my asthma management change secondary to COVID-19? And how do you talk to people about, just any changes at all that they should be considering if they have COVID-19 or suspect they have COVID-19?
I think the first thing is to just remember that your management really shouldn't change. If your child is supposed to be taking a daily preventive medicine, keep giving it to them. And if for some reason you'd gotten a little behind on it, start it back up, okay? This is a dangerous disease and we want to get their lungs as strong as we can. So if they're supposed to take a daily inhaler to prevent getting sick, or a maintenance inhaler or controller, those are all words we use for it, please keep giving it to them. And then if they are having symptoms of cough or difficulty breathing, give them their reliever medicine. Another thing we need to remember is it's starting to get warm outside. That means the allergens are coming. And so this is making it even harder for a lot of kids with asthma. Just the outdoors in the springtime is a terrible trigger for them and is sending them into a lot of symptoms. So treat their allergies, give them their Zyrtec or whatever it is that they take for their allergies. And again, if you need refills on your prescriptions for any of these things, talk to your doctors. Normally, a lot of times we would make you come in if it's been a minute since you've been in and been and seen, but these are kind of special times, so we might refill you for a month or two, just to make sure that you're prepared with your family to get through this.
Right. And common follow-up question, do medications for asthma, such as steroids, help protect against COVID-19?
They make your lungs stronger. Your inhaled corticosteroids make your lungs stronger and more able to resist any kind of challenge, right? So if you're supposed to be taking them and you are taking them, good, because that means your lungs are tougher. That doesn't mean that you can't get COVID-19, okay? It just means that if it happens to you or your child, you might be a little bit better prepared to deal with it.
Mm-hmm. Okay, and then our last question, Dr. Paul, I'm going to put this one to you. And this is another one that I have to say gets asked a lot, is how can I protect myself and or my child against COVID-19?
Well, I wish I had some very fancy response to your question, but it's just the basics. It's really washing your hands frequently and well, taking those good 20 seconds to do it. Doesn't need to be antibacterial or antimicrobial soap, just any old soap will do. Also, avoiding touching your face so that you don't introduce the virus to your mouth or your nose accidentally after touching something. And then surfaces that are touched frequently. When you're at home, make sure those surfaces are clean. And social distancing, staying at home and making sure that you keep those distances when you are out in the community. Those are the best ways to protect yourself.
Thank you. And thank you, Molly. Thank you, Dr. Paul, for joining us on this. As I said at the beginning, the Ask an Expert series is an ongoing thing, and we are taking questions from people in the community and also through our various clinics so that we can get answers to some of the common questions that people have. So I would just invite anyone to go to our website, chicagoasthma.org, and there's a link right there where you can ask any question, and we'll bring on an expert and have them answer it for you. So thank you both again for participating. And yeah, we'll see you guys next time.
Thank you for having us.